Hello, this is Lillian Velasco. I'm a physical therapist currently based in Baltimore, Maryland. I work as a home health physical therapist with majority of my patient population to be aged 50 and above. My presentation today is about predictors of continuum of care from hospital to skilled nursing facility to home and to nursing home. I chose this topic because I think it is important to identify factors that can assist our patients to successfully achieve their optimal health and functional status for better quality of life. So why is effective discharge planning important? Let's first look at the statistics for background. As of 2015, there are 47.8 million Americans aged 65 and above. This population group is expected to grow to 98.2 million by 2060. Although in 2007, the 65 and above age group is only 13% of the entire population, it accounts for 37% of hospital discharges. Further, for every 5 hospitalized patients, about 1 of them is readmitted within 30-day discharge. With a projected increase of this population group and changing course of insurance reimbursement, it is ever more important to utilize limited resources through evidence-based planning. Physical therapists, particularly in the acute setting, play an important role in appropriate discharge planning. Discharge planning is a complex process consisting of multiple healthcare providers, such as discharge planning coordinators, nurses, social workers, physical therapists, occupational therapists, and doctors. The primary goal of discharge planning is to identify the optimal location and services that a patient requires in order to continue recovery. Cadivar and others found that patients had 3.78 times greater odds of being readmitted if a physical therapist is not involved in the discharge planning. Other findings are as follows. In the physical therapist participation group, patients had greater adherence rate of 73% in the discharge plan. On the other hand, in physical therapist absent group, patients discharged to their home were 2.47 times greater or 147% increase in odds in 30-day readmission than for patients who are discharged to other inpatient facilities. The bottom line here is physical therapists' involvement in discharge planning can reduce risk for readmission. What mobility measures can we use in determining whether a patient can be discharged at home or can benefit from a skilled nursing facility placement? A patient who is ambulatory prior hospital stay should be considered for a skilled nursing facility placement if the following characteristics are exhibited: slower gait speed of more than 0.6 meter per second, shorter 2-minute walk test distance, lower Tinetti balance subscale score, self-reported difficulty walking across the room, and use of an assistive device. What predictors can be considered to determine if a patient can be discharged to home after a skilled nursing facility placement? 7 tests from functional independence measure are found to strongly predict an individual's discharge readiness. Functional independence measure is a 7-point ordinal scale tool that measures the level of a patient's disability. It can determine how much assistance is required for a person to carry out the activities of daily living. 4 out of 5 cognitive tasks, namely comprehension, expression, problem solving, and memory, and 3 out of 13 physical performance tasks, namely grooming, toileting, and chair transfer, are found to be predictive. Age and diagnosis are weak predictors, and further research is needed to determine if socio-demographic variables such as social support, marital status, living environment prior hospitalization affect outcome of discharge. What predictors are useful in determining individuals at home be placed in a nursing home? Strong predictors for nursing home placement are cognitive or functional impairment, or both. Dementia is the most common cause of nursing home placement. It is also the strongest predictor as it involves both cognitive and functional impairment. A decrease in function alone, as objectively measured by self-rated health status and objectively measured by ADLs and IADLs, high number of prescriptions, and prior nursing home placement increase an individual's risk by 2 to 6-fold. These indicators are all strongly associated with chronic medical conditions. Other variables with strong evidence are increased age, not having one's own house, and being white American. Our questions for the discussion board this week are, firstly, what is your experience with regards to discharge planning in your work setting? What are the steps you undertake in preparation for discharge of your patients? Secondly, do you have patients who after a few months are back under your care? Cite some of your observations as to possible factors that have affected their decline. And lastly, what recommendations can you provide to your patients to maintain their functional gains after completion of their physical therapy services? The last 2 slides contain all the references that I have used for this presentation. Thank you for listening to the presentation, and I'm looking forward to our discussion board.